Assalamu alaikum, everyone. As you are all aware, that during this pandemic, senior and older adults are the most affected. So today I am collaborating with Nisa Helpline to present to you this live session on elders' challenges during COVID. Nisa Helpline is a registered charitable organization that provides peer counseling and resource support to vulnerable women in our community to live a fulfilling and dignified life. Up to 500 calls a month are received by the helpline from women battling grief, fear, loneliness, abuse, marital discord, mental health illness, these days COVID 19 impacts, and the list goes on. Nisa Helpline provides toll free, peer to peer counseling and emotional support to Muslim women across North America. Since its inception in 2014, the helpline has received over 26,000 calls from women from all walks of life seeking help for issues like mental health, marital conflict, abuse, loneliness, addiction, Islamophobia, self esteem, and much more. NISA helpline counselors are trained to provide proactive solutions to our callers and instill preventative measures. They provide the resources to our sisters so that they can get the personalized and professional help that they need to become whole again. I encourage you to support them by donation and sharing their resources. So, as I said earlier, today I would like to focus on the well being of the older adult and then also share some tips for the caregivers who are providing support to their loved ones. So, according to the Center for Disease Control and Prevention in United States, they say that among adults, the risk for severe illness from COVID 19 increases with age, with older adults at highest risk. Severe illness means that the person with COVID 19 may require hospitalization, intensive care, or a ventilator to help them breathe, or they may even pass away. For example, people in their 50s are at the highest risk for severe illness than people in their 40s. Similarly, people in their 60s or 70s are in general at higher risk for severe illness than people in their 50s. The greatest risk for severe illness from COVID 19 is among those aged 85 or older. There are also other factors that can increase an elderly's risk for severe illness, such as having underlying medical conditions or pre existing medical conditions, especially heart disease, lung disease, diabetes, or cancer, are more likely to have severe, even deadly coronavirus infection than other age groups. By understanding the factors that put you at an increased risk, you can make decisions about what kind of precautions to take in your daily life. According to an analysis of more than 114,000 COVID 19 associated deaths during May to August 2020, as said by Center for Disease Control in USA, they found that 78% of the people who died were aged 65 and older, and 53% were male, 51% were white, 24% Hispanic, and nearly 19% were black. So, COVID 19 remains a major public health concern regardless of age or race and ethnicity. So, due to the risk being higher in contracting COVID virus for the older adults, they have to keep themselves physically distanced and more so isolated. Already, this population was lonely before COVID as they were dealing with other mental health and physical challenges in their age. And due to COVID, the situation has become worse. We want to keep our loved ones safe, but not necessarily sad and lonely. Loneliness is thought to act on the body in a way that is similar to chronic stress. According to research funded by the National Institute on Aging, it raises the levels of stress hormones like cortisol, which impairs immune responses and contributes to inflammation. Prolonged loneliness is hard on the body and can leave elderly vulnerable to mental health issues like anxiety and depression and chronic conditions like heart disease and obesity. Another study published in JAMA Psychiatry, they found an association between feelings of social detachment and the development of brain biomarkers common in preclinical Alzheimer's disease. And even when an older adult is being taken care of by their family caregivers, one doctor from Albert Einstein College of Medicine, Department of Psychiatry and Behavioral Sciences says that there is often little attention paid to deep, engaging communication between a senior and the rest of their family. The changes listed above certainly play a role, but caregivers are usually so worn out from juggling their day to day responsibilities that they have little time or energy left for single handedly meeting all a senior's emotional and social needs. I would like to now share certain tips on how an older adult can take care of their mental and physical health. If you are a caregiver to such person, you can provide these tips to them. Most of these tips are from my own experience as I took care of my mother who was an Alzheimer's patient for many years, and then now my mother-in-law who's in her 80s. So, first thing that I would suggest is to stay positive. It is very important that the person focuses on glass being half full rather than half empty. Try to focus on what they are still able to do rather than what they have lost due to their age or right now due to COVID. In addition, caregivers and family members try to help elders feel in control of the precautions they are being asked to take. So they feel involved rather than feel punished by the new rules. Talk with them about the public health crisis they have lived through in the past. There were many epidemics: polio, tuberculosis, SARS, or H1N1 flu in the past, and I'm sure they remember what happened at the time. Do avoid listening to the news about the increase in cases and people passing away from COVID, as it can just contribute to their anxiety. Eating on time and setting a routine about it is really important as well. With age, we often notice that our elderly, their appetite has become less. Often, at times, it has become difficult for them to chew or digest certain foods. It is very important that the body is getting the nutrition that it needs. If one cannot have a big meal, they can eat 4 to 5 times small meals with healthy snacks. My mother in law, at present, she's staying with her daughter in the States, but before that, she was staying with us. And throughout the day, we would try to give her yogurt or some fruit if she couldn't have a proper meal. And that kept her active and energized. In our body, energy is produced through oxygen and glucose. Oxygen we take from the air around us, and glucose through the food that we eat. So, it is very important to keep the person active and energized. We are eating regularly. Another thing that is very important to keep a person healthy is regular sunlight and fresh air. The body gets vitamin D from sunlight, which helps with mood. Find time to sit in the sun for 1 to 2 hours every day, and if possible, get some fresh air. It's going to be cold soon, but until then, even a few minutes every day breathing fresh air can help with the immune system. Related to fresh air, of course, it's staying active. If you can't take a walk outside, try to take a walk within the home. If we can provide our elders with a Fitbit, they can set a goal for the number of steps they do every day. I have a patient, she's elderly, so she was recommended by her dietitian to wear a Fitbit and do specific steps every week. So she started with just a couple of hundred 1 week, and then once she accomplished that goal, then she added another 100 to her goal. So in this way, she kept increasing her number of steps every day, and it kept her going, kept her active, because the goal was keeping her motivated to do the steps. If, for example, they can't walk much, are not mobile in the way where they can take steps, they can, what they can do is, even sitting down, they can get up 10 to 15 times per day. Try to go to the washroom by walking. Even sitting, they can do certain exercises with their legs and arms. There are multiple exercise options available on YouTube. We can go and explore those, where people can be sitting down or standing on a just one place, and they can be doing exercise with their legs and arms. Especially, I think right now it's so important because soon it will be winter. Already there are places where it's really cold and it's difficult to go out. Keep moving keeps their muscles active as well, and of course then they need to have the stamina to keep going. Another simple task that they can do to keep active is to cut vegetables at home for cooking. They can do water the house plants if there are any house plants. So just do small activities to keep themselves active. Then having a project. Working on a project daily can also keep one motivated. It can be just doing small um, errand like mending clothes, starting indoor plants. We can grow different kind of herbs indoor. Putting old photographs in an album. You can take out um, um, old photographs, buy an album, and an elderly person can sit down and organize the photographs in an album, and also they can label them, and that keeps the interest going as well. The time when the photograph was taken, who is standing in the photograph. I think the younger people in the family can also help their elderly relatives, their grandparents, or their aunts to complete an album like that. Another project they can do is they can start to write their memoirs. I remember a few years back, my grand my mother-in-law was visiting me, and it was winter time. She couldn't even go out for walks. So then my husband asked her, "Why don't you write stories from your life when we were growing up?" So she started to write those stories, and I remember she would always come out once she'll remember a story and she'll share it with us. That this is what she has written down today. Another thing I remember from my own grandmother, my she was in her 80s and wasn't that mobile. She used to get bored, and my aunt asked her, "Why don't you start to write recipes of food that she used to cook?" She was a great cook, and then later on, all the recipes she wrote down. It was compiled in a book, and when I got married, actually, I learned to cook using those recipes. So these are certain projects that older people can do while they are sitting at home. Then another thing is very important, staying connected. So talking to someone regularly. Often the caregiver may be tired to sit down and have a talk, but we can ask our family members to stay connected with our elderly loved one. They can give them call, or if the elderly person can dial numbers on the phone, they can connect with them. These days, WhatsApp is there. The calls are free. 3 to 4 people can FaceTime at the same time. So, this is another way to stay connected. Then, starting a hobby. There are adult coloring books where people can, you can order them from Amazon, or you can even buy them from dollar shops where if someone is interested in coloring, you can provide them with crayons or pencil colors, even paint, water paints if they are interested and would like to do that. It will keep their hands and their motor skills active as well if they color and paint. Then also puzzles can be something that they can do. Knitting. I know my mother-in-law, she loves to knit. Whenever she's here, she's always busy knitting sweaters for her grandchildren, especially if there is a baby due in the family. So this is her best project that she'll knit a sweater and caps for the newborn. Then another thing is watching old movies with families. It's always a favorite pastime. I remember it was always fun sitting down as a family and to watch old family videos as well together as a family. Especially now, if the children are older, seeing them when they were young, that can be a really good family activity. Sitting everyone down and watching them with our elderly relatives. Often, our elderly folks are connected with the mosque, going to do their prayers at the mosque was a regular activity for them. But now, due to COVID, they have lost that. So we can try to set up a phone call with their mosque buddies. Also, we can encourage them to memorize small duas from the Quran. I know one of my aunts, she passed away a few years back. She lost her ability to see. She became clinically blind. So she started to listen to Quran from a tape, and then slowly she started to memorize small duas, and she used to feel so proud of herself then sharing those duas with her children. So giving them a sense of achievement as well. Another activity they can do is staying connected socially with the outside world is going for a drive with a family member and then buying a coffee, muffin, or even a cone ice cream from a drive-through window and then eating it in the car or bring it home. It will be an outing for them and they'll get some fresh air. They'll get to see other people, the world outside, which they are isolated from due to COVID. It is an opportunity to be outside while being in the safety of the car. Then organizing family get together on Zoom or such media. We have been doing similar activities, celebrating birthdays, birth of a child, even weddings. My son got married earlier this month, and we had everyone, there were around 30, 50 people around the world watching the wedding on the Zoom. And it was really good for us that the families were able to watch the event, but then it was really good for everyone else as well that we were able to be part of the ceremony. Self care is very important for anyone to keep fresh, but especially for people who are elderly. Hygiene is very important. It keeps them, of course, clean, but then also clean and safe from other bacteria. So taking a shower regularly, If not possible to take a shower every other day, then they can do a towel bath where they can wet the towel in hot water and just wiping their body with it, changing clothes, massage their hair with oil, put some ether. It helps them to be fresh, and then, of course, it keeps their mind active as well. So these were some tips for the elderly people, how they can keep themselves busy, organized, and then if they are doing each of these activities every day, it can keep them in a formal routine as well. Now let's talk about the caregivers who are taking care of their elderly relatives. The caregiver can be a daughter, daughter in law, or a spouse. As I said earlier, their days usually are so worn out from juggling their day to day responsibilities that they may have very little time or energy to take care of their elderly emotional and social needs. um, Professional caregiver who has experienced 6 decades of elder care experience. She shared that the structure of families these days also plays a big role in elderly being lonely. She says that a modern trend is the breakdown of extended family relationships, like those between grandparents and grandchildren. This has caused many elderly people to feel as though they have been pushed to the side and forgotten about. Family units that have expressed across the country find it particularly difficult to make time for visits and even regular communication by phone and mail. So it is important that we include other people in taking care of our loved ones. I will share some strategies that may make things easy at home. So, the most important thing is to keep the caregiver keeping themselves well. First and most important, you should take all the precautions you can to avoid becoming infected yourself. So, here are the basics. So, wash your hands frequently with soap and water for at least 20 seconds before and after providing care, preparing food, using the bathroom, or touching surfaces in public places, avoiding crowds, and if you cough or sneeze, do so into the bend of your elbow or into a disposable tissue. Keeping your hands away from your face. Clean frequently touched surfaces in your home, often including mobility and medical equipment used by your loved one, such as walkers, canes, and handrails. Practice physical distancing, but not social isolation. Stay connected with your friends. Often, people taking care of elderly isolate themselves as they are scared to contract the virus, but then, of course, it affects their own physical and mental health. So, it is important that they also stay connected via phone or online via Zoom with other friends. If possible, they can be physically distanced but meet their friends. These days, if everyone is home, there is more work for the caregiver. Children are also um, working, going to online school. So, of course, it adds to the work of the caregiver. Divide work in days. Assign days for cooking, laundry, cleaning to make time for yourself. This is very important that regardless of the work, block a certain hour as me time. Do something that helps you relax and you enjoy. For example, having a quiet cup of tea by yourself while you watch an episode of your favorite show, having a date night with your spouse by watching a movie together. In the beginning, you may feel guilty, but in time, it will make you feel good about yourself. Often, we have noticed if we are taking care of of our elderly parents, especially daughters, we ourselves are in our 50s. And of course, we may not be as energetic or be able to work as much as we used to just because of our own age and the limitations that we have acquired due to age. So it is important that we are focused on our self care. We can only help others who depend on us if we are in good health. So, eating, when we talk about self care, it includes eating right and regularly, exercise, and sleep. Sleep is very important. And then doing activities that help us relax. So, do remember to take care of yourself first before you have to take care of the loved one. Then it is important that we are flexible. Often we are not able to accomplish everything that we had planned for the day just because we have too much on our plate. If there is too much going on a certain day, prioritize to complete what is important. Be kind to yourself and not feel guilty as a mother, daughter, or a wife. At the end of the day, we are humans and not robots, and we all have our own limitations. So it's very important that we are flexible and not really hard on ourselves if we are unable to complete certain tasks. Then it is also important that we are patient. We are taking care of our loved ones who are maybe going through some physical health challenges. They may be in pain all the time, may have a chronic illness which makes them to be in bad mood at times. It is important that we try to regulate our own emotions and give ourselves time and leave the situation if they are in a bad mood to take a little bit of a break. And then try to share the work by involving other family members or getting help from your friends. When I say family members, it can even be children who can sit down with their grandparents or their other older relatives at home, talk to them about their memories, about the times when they were young, when they were taking care of their own children, any other memories from the past. You can ask your husband to help you out at times as well. And then involve friends. We all have one or two good friends who would love to help out. I remember I took care of my mother for 6 years. She was at home and had Alzheimer's, and regularly my friends asked me if I needed any kind of help, and they were all there. Sometimes I wasn't able to cook. Maybe I was so tired, so I would ask my friend if she could make a meal for me. So, just small things. I think everyone right now, because of the times we are in, we all want to help each other. One important way to lower the risk of your older family members catching COVID is limit in person visits. So, as I've said earlier, technology is the best way to stay connected. We can show our elderly relatives how to video chat with others using smartphones, give them laptops or tablets. You use apps on these devices to provide captions for adults with hearing challenges. Encourage friends and family outside of your household to telephone, as I said earlier. Write notes or send cards to lift your loved one's spirits. Minimize the risk of COVID 19 infection. Postpone unnecessary doctor visits. If an older adult in your care is feeling well, consider helping them postpone elective procedures, annual checkups, and other non essential doctor visits. But keep in mind that many older people, especially those living with chronic illness, have important relationship with their caregivers. And of course, doctors are also part of their caregivers team. To help them stay in touch, ask their doctor's offices if they can offer telemedicine, which enables doctors and patients to communicate over video, email or other means rather than face to face. They can also do these days phone appointments as well. Avoid travel. Older adults should put off non essential travel, particularly cruises or trips with itineraries that would expose them to crowds. And then a very important thing is decide on a plan. If you can, involve your older family member in discussions of how you will manage interruptions of routines and what will happen if they or someone else in your family becomes sick. Talk things through ahead of time, as a family can reduce stress and help everyone feel more involved and prepared. It will also reduce your anxiety and theirs if you have a plan in place. Pick an emergency contact. If you're the main caregiver, designate someone nearby whom you could rely on to care for your elder family member if you yourself become ill. And then stock up. Gather 1 to 3 months of medications for your elderly loved one, and at least 2 weeks worth of food, over the counter remedies, if you have any pet supplies and other essentials. Find out which delivery services are available in your area, just in case if you do get sick and you have to isolate yourself. So it's always good to be prepared in these unprecedented times, just to reduce your anxiety. Now, other interventions that are available here um, in the city. I'm from Edmonton, but there is a Canadian Coalition for Seniors Mental Health. You can Google online, find their website, and try to see they have multiple resources for seniors if they are going through challenges, or for caregivers as well. Then also there is SAGE, that's also an organization to support seniors. You can say it stand for SAGE, it's an acronym, and they are offering different programs via phone on different languages. People who had home care services, I know they have been reduced, so private in home care services are also available if you're able to pay for hourly services. You can go online and find out in each province they are available, and see what works for you. Then there is a national initiatives for care for the elderly. You can call and talk to a social worker to chat. This is a service for the elderly who are lonely, and this is a service out of Ontario. It's called National Initiatives for Care for the Elderly. Then other, as I said, provincial health services offer home care supports if just in case your elderly is having a problem in their mobility while they're going to the washroom or getting into a tub, having a shower, eating their food. You can always check with their family physician, get advice, and then also ask the home care service to come and do an assessment and provide advice to what the elderly individual needs. So this is very important that we try to reach out for supports. If we are elderly ourselves, or if we are one of the caregivers, all these services are available. We can go online to check them out, and through our provincial health services as well, we can get support. If you are not able to do that, please connect with the family physician. They will have a connection with social workers. Sometimes they have counselors in their clinic as well. They will be able to help you out. I do hope that the tips that I shared today will be useful. I hope and pray that all of you stay safe during these difficult and challenging times. I myself work with Islamic Family Social Services Association, and the acronym is IFSA. It is a non profit organization based out of Edmonton. We offer many programs which include a halal food bank. We are the second largest food bank depot here in the city. We cater to around 5,000 individuals per month. We also offer culturally sensitive free counseling and then support for people who are going through family violence. We provide holistic services to the whole family. We have a helpline as well that is on 7 days per week from 10 a.m. to 10 p.m. The number for the helpline, you can go on website ifsa.ca. You can get the number there, or the number is 780-900-2777. Let me repeat the number: 780-900-2777, and the website address is ifsa.ca. For any kind of information or help, you can call the helpline. Thank you for listening to me. If you have any questions, I can take them now. So it looks like there are no questions. If you need any more information about what I have shared with you today, you can connect with the coordinator with Nisa Helpline and find my information. Take care and stay safe.